Why was penicillin so crucial for syphilis treatment? Imagine a time when syphilis was a mysterious and often deadly disease, with limited options for treatment. Then came a breakthrough that changed everything. Penicillin was the first antibiotic that could reliably cure syphilis, including its most serious forms like neurosyphilis. Before this, treatments were risky, toxic, and often ineffective. Penicillin, introduced in the 1940s, revolutionized how doctors managed the disease by providing a safe, simple, and highly effective cure. It could target the bacteria responsible for syphilis, called Treponema pallidum, directly and eliminate it from the body. Early studies showed that penicillin could heal syphilitic sores and clear the bacteria from the blood during the initial and secondary stages of the disease. Higher doses of penicillin led to better outcomes and fewer relapses, making it a dependable treatment. Before penicillin, treatments included mercury, arsenic-based drugs like salvarsan and bismuth compounds. These options were often harsh, difficult to administer, and didn't always work. Penicillin offered a much better alternative, fewer side effects, shorter treatment courses, and a higher success rate. Its impact extended beyond individual patients. It helped reduce the spread of syphilis worldwide. For example, in the United Kingdom, new cases dropped by about 95% between 1946 and 1955 thanks to penicillin's effectiveness. It was also a game-changer for neurosyphilis. A severe form that affects the nervous system and was very hard to treat before. The availability of penicillin encouraged more routine screening for syphilis, which meant earlier detection and treatment. This not only helped individuals but also slowed the transmission of the infection in communities. However, the story isn't without ethical lessons. The infamous Tuskegee syphilis study, where treatment was deliberately withheld from African American men to observe the disease's natural course, reminds us of the importance of ethical medical practices alongside scientific progress. In essence, penicillin was a turning point because it was the first antibiotic that could effectively and safely cure syphilis. It transformed the disease from a widespread, often devastating illness into a manageable condition. This breakthrough paved the way for public health efforts to screen, treat, and prevent syphilis more effectively than ever before. Always remember, if you think you might have syphilis or any other sexually transmitted infection, consult a healthcare professional for proper testing and treatment options.